This is an answer to a patient who is severely sick with leukemia in the hospital, who sent me her blood test. The hemoglobin is 8.8 and the thrombocytes, platelet is 115,000. The white blood cell is 0.7 and the neutrophil 0.1, which means that she is with low neutropenia. Neutropenia means less. So she is on antiviral, antifungal, and antibiotic therapy to avoid infection. But the problem now is the protein is low. She's getting better. The CRP, C-reactive protein, is down from 300 to 41. And the problem is the protein low. And how do we know it clinically? Because she has a swelling in the feet and the lower limb, as well as there is collection of fluid in the abdomen, as well as in the left lateral side of the chest. So the amount of protein is gram per kilogram of her ideal body weight. Her height is 60. Her height is 160 centimeter. So her ideal body weight is 160 minus 100. So she is 60 kilogram, the ideal body weight. But now her body weight is only 50. So she has to take at least 2 grams per kilogram of ideal body weight, which means 2 by 60, 120 grams per day. And then she has to divide it into 4 meals. Each meal to take 30 grams, because this is the maximum the body can use, and also to prevent the change of protein into glucose. So she has to calculate how much protein to eat. And the protein is, for example, egg. Small egg, perhaps it is 5 grams, medium egg 6 grams, big egg is 7 grams. So if she take 2 eggs of big organic egg, she will take 14 grams. Also, she can take cottage cheese, and it depends how much protein per 100 gram, and how many cc's in the tin. So one has to read, if it is 10 gram protein in 100 ml of cottage cheese, she can take 100 gram of cottage cheese, or 200 grams of cottage cheese, which means that you will take 20 grams of proteins. Also, ricotta cheese. Ricotta cheese is very good, and it depends. Suppose, for example, I buy from Turkish shop is 200 grams, and each 100 grams contain 10 grams protein. So if you take half this cheese, one take 10 grams. If you take all the 200 grams, then she will take 20 grams of protein. Also, in the salmon, one has to read or Google how much, but I Google it, and it is in 100 grams of salmon, about 23 grams of protein. And in a breast, chicken breast, it is about 32 up to 43 grams. It depends on the chicken cuts. For example, in the thighs is less protein. So one can Google how much protein and to eat. For example, kefir. Kefir is very good protein, and about 4 grams per 100 ml, like the dairy milk. And there is organic kefir, and if one take a cup, then this will make 12 grams of protein. So it is essential to take 2 grams per kilogram body weight. Why? Because of the age. If the age is about 80 years old, and she has very weak muscles, to make muscles, this is very important to take protein. And in the elderly, we have to take more, because the digestion and the assimilation of protein is more difficult. And because of the severe disease of leukemia, so that patient needs protein to repair the immune system and to repair the cells which are damaged by cytotoxic or chemotherapy. So this is an advice to a patient who is severely ill in the hospital about the protein. Of course, the patient needs also sodium and potassium, because they are low. So she can take a supplement, and she can take it in the diet. Food which is rich in potassium and salt, she can add to the food. And then the blood will be tested every day. And this will help the swelling in the feet and the water or the collection of fluid in the abdomen and in the chest, which is due to a low protein in the blood. This is related to physics, which is called osmotic pressure, and the balance of the fluid on both sides of the cells. This is just for information, and thank you and goodbye.